Good afternoon and welcome to Reframe Cancer's latest webinar. This one focuses on some recent research that was undertaken, the Employee Experience Survey, which looks at how people were feeling during working and living with cancer. Today I have with me Mark Stevenson, the CEO of Reframe Cancer. Mark, would you just introduce yourself, please, and just give a quick overview of your background and experience?
Will do. Thank you, Sean. Yeah, I'm really excited to go through the survey results we've got here. It's really illuminating, and hopefully you'll see that as we go through. My background, I've spent the last 20 years working in healthcare, running a variety of different businesses in areas such as pharmacy, dentistry, and care. I've been the CEO of Reframe Cancer for almost 2 years now, and passionately believe in what we do, and hopefully that'll come through this afternoon.
Fantastic. Thanks, Mark. Just to give you a quick overview on the kind of things we're covering today, the report is quite extensive, but we've tried to pick out some insights and some helpful information that will help advisors talk to clients, consider products, and work out how cancer might fit into the suite of products. So we're looking at things like healthcare, private healthcare, and how many people have access to it based on our survey results. We're also looking at employee benefits, or whether the employee benefits for someone with cancer really stand up to scrutiny, and the correlation between support through cancer and whether that does impact on people staying with the organisation or whether they are considering leaving. So we've got a whole series of points. We'll get to this as quickly as we can, and hopefully there will be some useful insights there that you can apply on your daily basis. So Mark, just to touch on research for a little, just briefly, you're the architect behind this research. You felt it was an important thing to do, something that was perhaps under-researched, under-surveyed. Give us an overview on why you felt it was important and why you made this happen.
Yeah, thanks, Sean. Although there have been some surveys of cancer in the workplace, a lot of them are very out of date. Also, there's certain obvious questions to ask that I don't think have ever been asked before. Things like, people returning to work after cancer, are they good for the business or not? We've got some really interesting results around resilience, and also absence. So actually, how much does cancer absence cost people? And if that could be reduced and improved, you could then start looking at a return on investment as well, which is obviously really important for a lot of the conversations that you might have. In terms of the survey, again, we felt some of the previous surveys seemed very tilted around probably the higher earners. We wanted to make sure that we got a really good cross-section of the 500, that people have had cancer in the last 5 years, and a real broad spectrum of people across the UK, and that's exactly what we got, which is why I think the results are as interesting as they are.
Yeah, absolutely. Thanks, Mark. Yeah, 500 employees all working or have worked with cancer. So these are people with very first-hand experiences of how they were treated and how they managed the cancer journey. But I guess we can't really start without looking at the numbers, Mark, in terms of prevalence of cancer within the UK.
Yeah, thanks, Sean. It is really interesting to look at these. Unfortunately, again, some of these numbers are really out of date, and the cancer research number of 127,000 that some people will be familiar with is now 6 years out of date. Actually, if you look at the NHS data on people diagnosed with cancer aged 20 to 68, take it unemployed, you actually get to 190,000. But let's be safe and say it's 160,000. So cancer also, the amount of people being diagnosed grows at 1.9% per year. Again, that stats miss, so it's growing. The amount of people getting cancer is growing all the time. Sadly, it's growing in the youngest, the quickest. So there's a real increase of cancer with younger people. So I know people think cancer is for older people. That's not the case. The prevalence is growing all the time. When you look at this 160,000, you look at the 900,000 people who are living in remission. We believe that number actually might be nearer to 1 million. When you look at the 850,000 people who are caring for someone with cancer, again, that number's out of date. You actually get to 1 in 16 people impacted by cancer in the workplace. That's significant. So this isn't something for a small number of people. That's a lot of people who are impacted by cancer. Why everyone should be talking about it and looking at the solutions they've got in place.
Indeed, and I guess the research kind of plays off the platform of these numbers to try and understand them a little bit better, and create some kind of thought and insights that might help employers, advisors, and healthcare generally understand and come up with solutions for the challenges. Okay, so the survey also looked at employee benefits and the expectations of the individual versus the reality of what they're receiving. Some interesting points here, Mark.
Yeah, definitely. So you've got 77% of people feeling that their employee benefits didn't fully meet their needs. Again, we're not I mean, it's a big number, but we're not over surprised, because if you think about it, pretty much every EAP scheme, there is nothing on cancer support. There's obviously quite a bit on mental support, mental health support, or on private GPs, things like that. There is nothing on any of them, and we know them all pretty well on Pacific Cancer Support. You've also got PMI that yes, for some of them, pretty much all of them do cover treatment. A lot of them don't cover diagnosis, and certainly pretty much all of them don't cover support and helping people through the cancer journey. So I'm not surprised by these numbers. And of those, you've got loyal employees and lowest earners feeling the most unsupported. So on the lowest earners, 58% coming out feeling not supported. That's not good for employers, and even loyal people who've worked 4 to 10 years feeling unsupported as well. These are not good stats.
Thank you. So you know, I guess what this highlights is the need for employers and workplaces to really understand what benefits are available to their workforce, and clearly some that have a higher earning capability may have more beneficial, but it's the whole of workforce consideration, I think, here, Mark, that needs to be considered, just to ensure that everybody, no matter their salary bracket, has access to appropriate support.
You're absolutely right, Sean. You know, cancer. Sorry, everyone knows this, but cancer hits everyone, whether you're on the C-suite or whether you're at the bottom of an organisation. It hits everyone the same, and I'm sure everyone would want to make sure that everyone in their organisations are supported through their cancer journey. Absolutely.
Thank you. Okay. The research also considered how people were getting their treatment. Obviously, there's a massive pressure on the NHS these days. We all know that. It's all very aware, and there's an expectation that private healthcare has picked up the baton to some extent. Mark, the numbers are quite clear, I think, from the research.
Yeah, they are. So you've got 62% of people who are navigating the NHS on their own, probably with no support, unless they've got a company like us helping them. And we do that. We do the Pacific NHS support for people. A really good example of that is that there is a bit of a postcode lottery with the NHS. So depending on where you live, the local cancer hospital could have exceptionally low wait times, or could have exceptionally high wait times. You are allowed to, with the NHS, move to any hospital that you want to have your treatment in. Again, people don't know that. Our team can absolutely help with that. I do really want to highlight the 30% are using both, and this is happening more and more. We're seeing a real trend for people to, in particular, have surgery done privately, but then going back to the NHS for chemo because it's either not fully covered in the policy or they're self-paying. The problem with that with the NHS, you always go back to the start. So unless you've got someone helping you navigate that, whatever time you might have gained by having the surgery quicker, you might then lose before you start your rounds of chemo or radiotherapy or whatever other treatment you're going to have. So it's really important, again, that navigation can happen there. Even with private, it's not the panacea that everyone thinks. As a whole, with private hospitals, it could be quicker, but it's not always quicker. So again, people need to understand that, again, depending on where they're living, the NHS might actually be a better solution time-wise. It depends on geography. Just on the right-hand side, I think there's some important information to get across. On average, and hardly anyone's using private GP, so most people are going to the NHS. You're going to do 3, unless you are really clear in your 10-minute meeting what your symptoms are. You're probably going to have, on average, you're going to have 3 visits before the GP refers you anyway. So you can imagine some people that might be 4, 5, 6 visits before they get referred, and that can be really bad news. The NHS is also struggling with cancer. You compare us to the rest of Europe, we've got one of the highest mortality rates, unfortunately, compared to the rest of Europe, so we're lagging behind. The target of 62 days, which isn't a very, that's a target that should be reduced significantly. That's only been met 64% of the time, and that's been pretty flat now for the last 2 years. We're not seeing any improvement coming through. And obviously we know that if we can pick up cancer earlier, pick up cancer stage 1, stage 2, you're almost going to double your chance of survival compared to stages 3 and 4. So this is all about speed. So this navigation part is so important.
Absolutely, and that's, I think, perhaps misunderstood in the sense that private healthcare picks up a portion of the treatment and NHS also, but the challenge is really getting them both to connect, and they don't often connect,
right,
as far as I understand.
Correct.
Okay, thank you. So also when we look at private healthcare in a little bit more depth, it pulled up some differences both across gender but also across salary and earnings capability. Mark, on this one?
This is probably of no surprise to anyone looking at these, that the more junior people in companies have got less private medical care compared to those on the C-suite. But even those on the C-suite, there's not everyone is covered, which often people think are. So there's lots of organisations that are going to need some level of support as well. Also, you see the mix of gender here. We were a bit surprised about this, but we want to probably try and dig a bit further. We're not going to surmise why you've got the male-female split, but I think it's more about understanding that the more junior people don't have PMI, and how they can be supported in an equal way on cancer is a thing for us all to get our heads around.
Yeah, absolutely. I guess it's the point about whole of workforce again, isn't it? That perhaps private healthcare is only available to a smaller number in some organisations, and I guess given the changes in costs as well, that is also a challenge for organisations too.
Absolutely, and things like our support. I understand with PMI, it can be incredibly expensive depending on the level that you take. Something like our support, it's not that expensive, so it should open up to the whole workforce.
Yeah. Okay, thank you. Okay, the next, so there's some insights which is kind of summarised from the previous couple of slides. So Mark, you'd just like to pick up this one, the insights from both the NHS and the private cancer care mix.
Yeah, so again, helping people through, it's obviously getting access to treatment as quick as possible is really important. With the cancer pathway, until treatment, it is all about speed. So the sooner you can get diagnosed, the sooner you can get your treatment booked in, that can make a significant difference. I mean, and for example, we're saving people 14 days, and we want to get better and better at what we do. So an organisation like ours can make significant difference. So the NHS, unfortunately, is underperforming. So therefore, I think as an employer, you have to look at how else can you help people get through the whole cancer journey. And then there's this thing about accessing both. This is really important. That we see people who've got some great PMI support, but we're doing a lot to help them as well. Again, it's on speed, it's on support, it's managing the work diary. Sometimes it can be other completely different things apart from treatment. But each round of treatment, so if you're looking at chemo, for instance, it's helping people this is eating right, being physically strong, being mentally able to cope. If people are in the best place, they're going to get through the chemo a lot better, and they're going to be able to return to work a lot quicker as well. So hence why support is really important for cancer.
Indeed, important point to make there, because treatment is one thing, support's another, I guess, and complement, and the support really does complement the treatment both pre and post. So important part of the cancer journey.
Yeah.
Okay. What we also found from the research was that there is a potential risk of losing talent. Mark, in terms of the responses on this one?
Yeah, and someone going, well, 11% is not a big number. We were really surprised with this number that 11% said that they were considering leaving because the lack of support an employer gave. It was higher than I thought it would be, and that should be a big worry to people. Again, when people are looking at oh, we can't afford cancer support. Well, this probably would justify it alone, that you've got that many people were so unhappy. I also think there's the ripple effect as well here, that you get normally get 50 people impacted by one person having cancer, the colleagues around them. So that's significant as well. So it's not just looking at those people are saying the support I get wasn't good enough. You've got all their colleagues who are not happy as well. So I think getting this right is really important. And of those that want to leave, some of them are younger. They're actually quite loyal. They've been 4 to 10 years with the employer, and some, you've got junior to middle management as well. So these are some potential future stars that you could be letting go from the business, which is not good. So I think it is really important to look at this.
Yeah, real cost of business as well, isn't it, in terms of recruitment for replacement individuals, and equally that age range is perhaps the most stark, isn't it, in terms of loyal individuals who've been with the business some time, and an area that to some extent perhaps overlooked, that from an employer's point of view, that there is a likelihood or a higher likelihood of people leaving because they just missed out on the support that they needed for them personally, personalised support. Okay, moving on to absence. This was something we really tried to unearth, Mark, and this is something that has really given us some good information.
Yeah, we're surprised that no one's thought to do this before. It's a really obvious thing to ask and to understand, to look at the absence caused by cancer. So this is the official time that people took off. What we don't know actually is the unofficial time. So this is what people declared that they took off. So this could be actually worse. We didn't think at this stage that was the right thing to ask. This is the time that people took off, and you're seeing it spread across from symptoms obviously growing to diagnosis, then to treatment and recovery. So this adds up to 75 days overall, which is significant. And of course, this varies. You might have some people just with a few days, some people maybe hundreds of days. But this is a big survey, so that is a really good average that's given. And when you apply that on an average salary basis and times that over the UK, that's costing UK businesses £1.6 billion per year. That is a lot of money and a lot of cost for people. So if that could be reduced, you've got the cost savings from that, but actually you've got happier, healthier employees as well, which I think is really important. One interesting part of this, probably not surprising, lower earners took less time off and they probably felt the pressure to return to work quicker. That might not have been, from a health viewpoint, the right thing for them to do, and it might affect their long-term recovery. So, but that's interesting that they're coming back to work earlier. And obviously, the early stages, it's really important, and that's where people, really, you've got to help them. So we'll talk about stigmatization later, but that some really concerning numbers coming through from this.
Yeah, absolutely. And I think what is notable is that the research also shows that just over half of people with cancer didn't inform their employer until they'd had a diagnosis. So as you can see from those numbers, 28 days potentially of absence before they've mentioned to their employer, potentially missing out on all sorts of support that was easily accessible. There may be other factors involved there in terms of concerns about earnings perhaps, or financial status and career prospects, but ultimately the communication is key as well, to ensure that people get the support they need. Okay, so moving forward to the lower earners in a bit more detail, Mark. There's the survey looked at the impact of individuals who were typically earning £30,000 or less, so national average, and there was a number of things here that were highlighted. Yeah,
so you got 58% of lower earners saying that their support didn't meet their needs. That's really worrying. Obviously, you've got very few of these guys being able to get access to PMI. They've taken less time off, but they're more likely to leave. So this is a cohort, we think, that with cancer that really should be looked at. And we've seen massive improvements made in mental health, looking at the whole of the workforce. We absolutely think with cancer it should be the same. Why should cancer be different to mental health? So trying to look at the whole of the workforce, I think, is the right thing to do for employers.
Yeah, absolutely. It's an important one because I guess the individuals who are earning less, they do have concerns about their career and earning potential. So maybe they feel they need to go back to work sooner, perhaps as well, which means longer term outcomes may not be optimum on that basis. Yeah. So an important consideration for individuals who are earning less, but equally still have a challenging cancer journey that needs proper support. Okay, so really, we just try and summarize this all into 4 key points. There's lots of information from the report, but what we're trying to do here for the sake of the advisor audience is to give some key highlights and help you understand a little bit better. Of course, we can have conversations with you guys individually if you need further depth of information. But Mark, there's 4 key points here that we think worth highlighting that come from the research.
Yeah, so yeah, I think these are 4 really good points to take forward. So there's this increasing need for navigation, especially actually as more people do go towards private treatments as well, navigating both between private and NHS. You can see the amount of people that are doing both. That becomes a skill and a requirement that actually lots of people just haven't got anywhere. So you need to come to a company like ourselves to help you do that. In terms of new products, that again, as I alluded to earlier about like mental health, I think most employers have got to start looking at the whole of the workforce around cancer. You can't just have a few people at the top being supported. So how can you find a way to do that is very cost effective as well? Then employers should be reviewing the benefits they've got. So they might have some benefits already in place. So looking at the PMI that exists, does it actually really help in terms of navigation, in terms of support? If there are other benefits in place, could those be added to and supplemented with cancer as well? So looking at that and understanding from cancer patients. One thing I'd always suggest an employer to do, which you can pass this advice on, go and speak to people who've had cancer and ask them where the gaps are. That they'll tell you very much as our survey's just done to help people there. And then this thing around people want to leave and talent loss. So it's almost like if you don't do this, people will then choose to leave anyway and go to an employer that will help them. So again, trying to get this across to employers, I think is a really important point.
Absolutely, thanks, Mark. And perhaps an opportunity here just to sort of outline the kind of service that Reframe Cancer does. You know, it's cancer support is not widespread. I think that's clear. Reframe Cancer sits in a space that works both across employers, healthcare, advisors, and the broker market. Could you just give a quick overview on the kind of support and services that Reframe does?
Definitely. So I'm going to try and, it's always hard to summarize what we do in a few words, but you've asked me to do it, and I'll try and do it. So basically what we're trying to do until treatment starts is all about speed. So our team of cancer nurses and specialists, that's what we're trying to do. We're trying to cut every day out we can, and we can cut 14 days out. We're trying to continually improve that journey till treatment starts. Once treatment starts, it's then all about adherence and resilience. So a lot of people will actually drop off. So people who are on oral chemo, up to half of them will drop off. So people go through surgery, go through chemo, radiotherapy, immunotherapy. Each stage of that, our team is supporting people pre and post, getting them ready, getting them, there's a lot to do that is scientifically proven makes a big difference to people's treatment outcomes. Then whilst we're doing all this, we're trying to help them maintain work, carry on work. If they want to carry on working, how they can carry on working, how they can return to work quicker. That's a big thing we're doing as well. And then when they do return to work, that they're supported when they return. So for a lot of people returning to work, it's incredibly difficult to do that. That's a big bit of what we do. So what we are, as I say, we've got cancer nurses that are doing that. Now, another thing to stress is we're not probably as high cost as you think, and we're very flexible on the amount of support we give. So if people can't afford the full 2 years service that we give, we can cut that right down. So so whatever is affordable for people, we can look at as well. So we're very flexible now. We just want to help people who've got cancer. That's our main driver.
Absolutely, and that is the reason why we're here. I think to some extent is to help people who are challenged by a cancer journey to have the best experience they can and support them through that. So thanks, Mark. So just to finish up here, the full report is available and will be emailed to you post this webinar. It's also available to download. It's bigger than what we've discussed today. There's lots of points in there that help employers, help healthcare operators, private clinics, brokers, and insurers. So there's information in there that will be helpful to different types of audiences and interests. So you'll get that in the next couple of days. And just to give you a sense of if you do need support, because some of the conversation today has triggered something that concerns you or worries you, we have a team of specialist cancer nurses and cancer support managers who help individuals on a daily basis, day in, day out, with very personalised support. So if you do need help, then please get in contact on a personal level. If you need help on an organisational level or a business level, you just like to discuss how cancer support might fit into your product offering, please reach out. The number's there. Drop us a line, and one of the team, or maybe even Mark, will talk you through the details of the support we can provide. Because certainly, as an organisation, we are very keen to help as many people, and brokers and advisors offer us an audience that can really have positive impact on. So yeah, that is us. Thank you for tuning in. Thank you for listening. I hope you got something from it. By all means, reach out for more details, and we will tackle that individually. Thanks to Mark for giving his input and his insights. We certainly don't see this as the end of our survey and research activity. This is really the start, and we'll be getting more information as along the way, which will help everybody, specifically the people affected most, the people that have cancer. So thank you for that. We all appreciate your time, and look at the next webinar, which will be later on in June on our website, and we'll keep in contact by email. Thank you very much.
Thank you, everyone.